Hi there, how are you?
Alright.
My name's Liz, I'll be your counselor.
Uh,
So, before we get going as to, what brought you into counseling today, I just wanna go over a couple ground rules, just so you know them moving forward before we start getting into why you came. So just so you know, our sessions are confidential with a few limitations. I am a student right now, so all of our sessions are going to be recorded, and that's just merely for the purpose so my supervisor, has the ability to look back to make sure that you are provided with the best services that you can be provided with, as well as a few things regarding abuse under the age of 18 and currently depending on the situation, but I am a mandated reporter for the state, and if you report any type of abuse that is a reportable offense, we will have to report it to the appropriate agencies, okay? Alright, so what brought you into counseling?
I'm looking to do a career change. Trying to get my CDL. I am currently prescribed Adderall. In the trucking industry, you can't be prescribed any amphetamines, and it is federally regulated that all companies you work for do drug testing, random drug testing.
Okay, and how long have you been taking the Adderall before you're discontinued it?
Well, I stopped taking it about 2 weeks ago, and I've been prescribed it for a good while. I would say probably about 4 to 5 years.
And do you have a diagnosis of ADHD?
Yes.
And are you having some adverse effects since discontinuing the medication?
Yeah, just tired, mopey, depressed.
So before we get into what's going on, I'm just gonna go over just some basic information that I'll just need to gather so that we can have it moving forward. So your first name's Kyle, what's your last name?
Barnes,
And marital status?
married,
Okay, and current occupation?
I'm a butcher.
Alright. Do you have any interests or anything like that?
Yeah, I like to work on cars.
Okay. And would you say that your interests have decreased since you discontinued the medication?
Yeah, absolutely.
Are you currently in school?
No. I'm looking, I have to go to trucking school, but I have to come off the Adderall entirely because they too also drug test.
And work history for the last 3 years? Consistently a butcher?
Yeah.
Alright. Have you had any previous attempts at counseling before coming here? Do you have a doctor that oversees your Adderall prescription?
Yeah.
Are they aware of the discontinuation?
Yes.
And did they recommend counseling, or did you seek this out on your own?
Yeah, my hair.
Alright, do you have any family history of any type of like emotional disorders like depression, anxiety?
No, we're all pretty straight edge. Nothing drug related or even mental illness, not that I know of.
Okay. And any history of suicide? And then do you have any historical medical diagnosis like high blood pressure, asthma, insomnia, things like that?
No.
And we said that we're feeling depressed. Some fatigue. Are you having trouble sleeping?
No. Honestly, I think I sleep more.
And then before discontinuing the Adderall, you didn't have anything like this? If the Adderall was working well for you, you were able to focus and concentrate well?
Oh, yeah.
Are you having any troubles concentrating now that you've discontinued your medication?
Yeah, to an extent, certain things.
What would those be?
Problems focusing on. Just like daily household chores. When I'm at work, I have to focus, otherwise I lose fingers or even possibly limbs. But the Adderall would help me stay focused and concentrated on a lot of smaller tasks. Basically being more productive, where my ADHD, rendered that.
And what are you looking to get out of counseling?
I guess just a better mindset. Ever since I stopped taking it, I have depression, which leads to like fatigue, just basically where I am in life. I mean, I have my own place, my own car. I'm looking to start a new and better career, but like, I'm still depressed about where I am in life.
And do you have a support network outside of here?
What do you mean?
Like you said, you're married. So is your wife supportive of you going to counseling and working on your depression?
Yeah.
And is there anything that you're against trying in treatment?
Anything prescribed. Me personally, I'm not a professional, but I would want to take any more medicines.
Even if they were non-narcotic?
Maybe with some research.
Okay. So, just so you know, I think that it's important to kind of understand the side effects of discontinuing a medication abruptly. And I know you said your doctor was aware of it, and I understand that you most likely discontinue these medications because of this upcoming career opportunity, but decreasing a medication like Adderall does have adverse effects such as depression, fatigue, irritability, sometimes sleeping abnormalities, as it does alter the dopamine levels in your brain, in layman's term. So it could be why you are experiencing some of this depression. You said it's been ongoing for about 2 weeks.
Yeah, it was pretty immediate after, essentially stopped with cold turkey.
Okay. Alright, so I think that, we'll kind of come up with a game plan right now as far as things that we can try, as far as treatment plan options go, that might help, that, we can monitor over the next few sessions we have. So there are medications, I know you just said that, you might be open to options, but there are medications in place that are non-stimulant based or non-narcotic based medications for ADHD. Obviously, go home, talk to your wife, talk to your doctor. That might help with some of the concentrating issues that you're experiencing. I don't know if it's not going to be a one-time solve-all thing, but if you've been previously on medication for ADHD for the last 4 or 5 years, it might be worth something to think about. That way you are still treating your historical diagnosis.
Right.
also look at, just some like general coping skills to help try to manage the symptoms, as you're working through, getting over discontinuing this medication. Sometimes it can take a little while just for the dopamine levels in your brain to readjust. So this could just be something that what I would say maybe could be situational, but we'll kind of have to monitor it, you know what I mean? It might be difficult to give a very specific diagnosis right now of depression if it is a situational, based off of the other circumstances that you have going on. I think due to your insurance, we might need to come up with a diagnosis, but I would like to meet with you, one more time and just gather some more information before we do that. But it could just be something that is just a mood disorder currently, instead of something that could be like persistent depression or major depressive disorder. It could just be based off the circumstances, and if we look into some other medications, we might be able to help with the symptoms of depression.
Well, isn't the diagnosis pretty clear?
So with depression and any type of disorder, right, there's a certain criteria that needs to be met. So like for you to have had your ADHD diagnosis previously, there was criteria that you needed to meet with your doctor who gave you that diagnosis. For instance, or for example, I should say, you could be diagnosed with a mood disorder based off of just 2 weeks of symptoms, but not necessarily, it could just be generalized mood disorder versus something like persistent depressive disorder. Those symptoms need to be present for at least 2 years.
So you need to know why the doctor prescribed Adderall?
No, I don't necessarily need to know why the doctor prescribed you Adderall. I just want to make sure that we have all the information that we need moving forward before you get given a diagnosis, because that diagnosis, like your ADHD diagnosis, will be with you in your medical records, moving forward for the rest of your life.
Right.
So it's just important to make sure that we gather all this information and that we give you the correct diagnosis, and that way you get the best treatment available. Since the onset of your depression, have you experienced any type of impulse control or higher levels of energy during any period of time? Or has it just been pretty baseline, pretty depressed?
Pretty depressed. I mean, there's times where I'm irritable.
When was the last time that you engaged in any activities that you really enjoyed for yourself?
I had band practice last weekend.
How did you feel after band practice?
Pretty good. I don't want to say good, but not up to beat.
But not super depressed.
Yeah.
I just think things like that, like trying to build in time, at least right now, to kind of help boost your mood, might be helpful. So, I think next week, before you come back, if you take a couple of days to try to do something that might help you, as far as engaging in something that you enjoy and see if it boosts your mood, we can look back to see if that helped. And then we can also touch base again on the medications, as well as, talk about some coping skills next week when you're in here that might also help with the depression as well, and kind of get a treatment plan set in stone that we can work on over the course of the next 4 to 6 sessions.
So should I avoid things that make me, obviously I should avoid things that make me irritable, but like working on a car is something I like to do, but I find myself more agitated, more irritable when I'm working on a car because of a stupid bolt that doesn't want to come out. So should I avoid?
I think that if there's something on the car that you'd like to work on and you get going on it, and then something like comes up that could be very frustrating and create like increased irritability, you could just set, a limit for yourself, walk away, you know what I mean? Cause we don't wanna do anything that's gonna worsen, symptoms, but if it's, you're enjoying what you're doing at the moment and then you need to take a break, then I think it's certainly reasonable to just step away and take a break.
Okay.
Okay. Do you have any questions before we move on? Get you checked out for this session. I think when you come back, we'll be getting a little bit further into some of the stuff. Our first session today was just kind of going over ground rules, me getting some basic information, tailoring a treatment plan that we're gonna use moving forward. So I think we did touch on all of those things.
How long before I come back?
You'll come back in a week. And based off of what your insurance approved, you might, I'll have to look into it, but sometimes people get 4 sessions, sometimes people get 8 sessions, so maybe we'll meet weekly for the first few weeks, and if things start to get better, then maybe we can do bi-weekly for a couple more weeks until it'll be a lot of time that your insurance provides for you to come to treatment.
Okay.
Okay?
That's it.
Yeah, that was it. It was nice meeting you.
Thank you.